Hi, I'm Mike Hawkins. I'm a retired and disabled military veteran. Because my service disability affects my speech, I'm using an AI voice here today as an adaptive tool, just like someone might use a wheelchair for mobility. These are my words, my experience, and my message to fellow veterans and their families. We're going to keep this high level and practical. The goal isn't to sell you anything. It's simply to help you understand what's available so you can make informed decisions. And if you need help, my team is an easy next step. Did you know that according to the VA, less than 4% of eligible veterans over the age of 75 receive the care they earned and deserve? Most veterans and their families wait too long before asking for help. Not because they don't need it, but because the VA feels confusing or they're not sure where to start. Every veteran benefit you'll hear about today comes from one of two paths. The first is the VA healthcare system. This is a VA benefit and includes home care, clinic visits, and medical services. The second is the pension side of the VA, aid and attendance and related programs that provide financial help. Veterans can receive one or both at the same time, depending on eligibility, although there are limits. Through the VA health system, many veterans qualify for non-medical home care called home and community care. This includes help with daily activities like cooking, bathing, dressing, transferring, errands, and simple companionship. Some veterans qualify for a few hours a week, others for daily support. The amount depends on clinical need, which is evaluated by a VA provider. To qualify for home care, the veteran must be enrolled in the VA healthcare system and have a clinical need, meaning the veteran is unsafe alone or needs help with daily living. You do not need wartime service. You do not need low income. Most of the veterans we support fall into one of these categories: dementia, Parkinson's, mobility decline, stroke, frequent falls, or simply an overwhelmed caregiver who can't keep up anymore. The VA is very familiar with these situations. Aid and attendance is part of the VA pension system. It's a monthly financial benefit to help pay for home care or assisted living. The veteran does not need to be enrolled in the VA healthcare system to receive it, and surviving spouses can also qualify. To qualify for aid and attendance, the veteran must have served during a wartime period. Combat is not required. They must also need help with activities of daily living, such as bathing, dressing, or mobility. Financial limits apply, but the rules allow for medical expenses to offset income, meaning more families qualify than you might expect. Spouses rarely qualify for benefits from the VA, but spouses often don't realize they can qualify for these benefits. A spouse can even qualify for this benefit if the veteran does not need help or if the veteran has passed away. The veteran may have passed away many years ago. The time frame doesn't matter. If the spouse hasn't remarried and meets medical and financial guidelines, they may be eligible. These numbers shift slightly each year, but they give you a good sense of the financial support available. This income can dramatically reduce the out-of-pocket cost for home care. These misunderstandings prevent a lot of veterans from getting the help they earned. None of these statements are true. The VA system is broader and more flexible than most families realize. There are only two major disqualifiers: being on hospice or permanently living in a skilled nursing facility. But veterans living in assisted living or at home, and even those receiving Medicare home health, can still qualify for support. If the veteran is not enrolled in VA healthcare, the first step is enrolling. Once assigned a primary care doctor, families can request an evaluation for home care. It's a straightforward process, but many families appreciate help navigating it. For aid and attendance, the first step is locating the DD-214. From there, it's a matter of documenting medical needs and reviewing financial eligibility. Families can apply themselves or work with an accredited representative. The pension is reimbursable back to the application submission date, so the quicker you submit, the more you get. One word of caution: the VA requires a perfect application. Any mistakes or omissions will delay things. We highly recommend getting professional help. I founded Interim Home Care because I've lived the experience of suddenly needing help after a life of independence. We're a certified VA provider and a service-disabled veteran-owned business. Whether you use our care or not, we're here to help veterans and families understand their options and avoid the stress of going through this alone. If you'd like to talk through your situation, you can schedule a no-pressure call with my team at this link. We're here to help you understand your options, whether you hire us or not. Thank you for spending this time with me, and thank you for your service. I know how difficult it is to ask for help. You've earned these benefits, and we're here to support you however we can.